this video I'm going to talk about spasmodic dysphonia. Increasingly actually, I'll get sent an email saying, my voice is like this and like this. Is it spasmodic dysphonia? The difficulty with diagnosing spasmodic dysphonia is that it's very similar to a muscle tension dysphonia, but in a kind of an extreme way. And my personal view is that it probably grows out of a muscle tension that gets stronger and stronger in some cases and becomes a spasm of the larynx. What it really means is a kind of a dystonia, which is a spasming. We can get that in any part of our bodies. You sometimes see it on people's necks or arms, and very often they'll treat those with Botox to stop the muscle spasming. And they can do that for the larynx as well. The evidence more recently went to the fact that it was a neurological thing, like dystonias are, they're caused neurologically. But the very complicated thing about voice, again, is that it's influenced by so many things that with spasmodic dysphonia, if it's a milder case, then I think that's often treatable with voice therapy. And I've been seeing this increasingly more and more with motivated clients who do want to work on their voice. Now, sometimes they may have had some treatment, some Botox treatment, and it's been effective for a while, or maybe over time it's become less effective, or they feel that they would like to work on their voice with therapy because some people just don't like having repeated injections. So the injections to the areas around the vocal cords are to stop those muscles spasming. But with therapy, it's slightly a longer term business than people think. I think people would try therapy and it wouldn't work very well. But I think you need to have a really tailor-made program, because what I find, and I think other people find themselves, is that the therapy takes different forms for different people. So for some people, one or two techniques might be really effective and they can, learn to generalize those and make a big difference. Other people, I'll be trying those things and it won't work, and we'll try different things. There's many different ways to get someone's voice improved, and that's why it really needs a tailor-made approach. Also sometimes looking at emotional factors and stress factors as well, and things that can alleviate it a little bit. The more you understand it holistically, the more benefit you can make to your voice. So I think if people feel they have got this, and typically it will present like this kind of a sound, and when it's really bad it can sound really strangulated. And there are two forms. The strangulated one is called an adductor, and that's when your vocal cords, they add together too much, they squeeze too much, they're pushing in too much, so it really blocks off the voice a bit and the voice has to fight through a very narrow space like this. And it can be intermittent, sometimes it'll be like that and sometimes it won't be. And the other main type is called an abductor, and that's when the vocal cords pull away too much. So the person will sometimes be talking and they'll get all these breathy gaps in their voice, whereas the vocal cords don't stay together for as long as they should. And for that second type, the Botox is usually not so effective. It tends to be more effective for the adductor type, where you can stop the spasm and squeezing. So for either type, if the client's motivated to work on it, I really think having therapy is a good option. It's always a good option to combine with any surgical intervention anyway, but if you averse to surgeries, don't really want to go down that route, then try the therapy, but be prepared to not just have one or two, because sometimes this is a condition that needs more work than people tend to think to alleviate. It usually takes time to build up, and for that reason it takes a bit of time to sort out. But you may be one of the lucky ones who find that a few sessions goes a long way too. If you found this video helpful, please press the like button and subscribe to the channel.